Chelation therapy has been the mainstream treatment to remove heavy lead and metal poisoning from the body. But now a leading cardiologist has claimed it helps prevent heart attack victims from suffering another possibly deadly one. Now, some critics have called the off-label use of chelation therapy as quackery, but leading researcher Dr. Gervasio Lamas used to think so too. From naysayer to leading advocate, he's fighting a backlash from the medical community. We'll hear from him in a moment, but first, Newsmax Deputy Health Editor Nick Tate explains more.
Well, thanks, Lynn. You know, chelation therapy is one of those alternative treatments that non-traditional doctors and practitioners have been using for a long time, but it's largely been dismissed as fringe medicine quackery by conventional doctors and cardiologists who just don't believe that it has really been effective. But this groundbreaking new study has proven that, in fact, chelation therapy combined with high-dose vitamins can be very protective in preventing heart attacks in people who have already had a heart attack. Now, the new research was led by Dr. Gervasio Lamas, who is with the Mount Sinai Medical Center in Miami, who himself was a skeptic about chelation therapy until he did this study. It has changed his mind in a big way, and now he is working to change the minds of other cardiologists and conventional doctors, and they're giving chelation therapy a second look as a primary way to treat heart disease.
Thanks, Nick. And Dr. Lamas is joining us now from our South Florida studio. Dr. Lamas, it's nice to have you with us.
Thank you so much, Lynn.
What was it about the study that changed your mind and your viewpoint about chelation therapy?
Well, Lynn, I had a very traditional viewpoint about chelation therapy, and by traditional I mean that it was really not based on evidence. It was based on bias and what I had been taught by my professors. And I had always been taught that it was dangerous, it was quackery, and really that it was bunk. And I can tell you that I remember the day in 1999 when I decided that I needed to move forward and do a clinical trial to settle the question. It was a very nice but somewhat disheveled patient that looked a little bit like Lieutenant Columbo, walked into my office asking for chelation therapy, and I said, of course not, that's crazy. And then I realized that I did not have the data to be able to really say that with any degree of certainty.
So for those of us who
and so
don't
from
know
that day on,
what chelation therapy is, can you explain that?
Sure. A chelating agent is a molecule that is best thought of as a baseball mitt. So it's a baseball mitt with a negative charge, so it's like a magnet in the shape of a baseball mitt. A metal ion, and we get metals from the environment, lead from leaded gasoline in the old days and so on, pops into that mitt, and that mitt wraps around it and allows the body to excrete it. And that chelating agent plus the metal that was chelated is detoxified and then excreted. So the molecule that we're talking about, the drug, is a drug called EDTA, the initials of a long and somewhat non-illustrative name. And that's what most chelation practitioners have been using.
So Dr. Lamas, how is chelation therapy actually administered?
Well, the chelation therapy that we used is administered intravenously, that is in the vein as an IV, and each IV took about 3 hours to administer. We asked our patients to take 40 IVs, one weekly for 30 weeks, and then another 10 that could be spread out a bit longer. So it is laborious.
Is it suitable for every patient who's either had a heart attack or who is at risk to have a heart attack?
I can't really tell you exactly what the broad scope of eligibility is. We studied patients who were at least 50 years of age and had had a prior heart attack and had reasonably good kidney function. So for those patients, we found benefit. Other studies will need to be done for us to really pin down what is the exact population that will benefit from this treatment.
So what's so controversial about it?
The controversy really was that they had been reporting positive results, but in their own journals or magazines, and the cardiologists really weren't listening. It wasn't done in proper scientific format. And conventional medicine has a strong aversion to alternative medicine practitioners. for reasons that are just too long to go into here, but the conventional physicians are suspicious of alternative medicine practitioners.
So what was it about the results that changed your mind?
Well, we reach, as a scientist, you have a point where you reach an epiphany, and that epiphany is based on data, on information. So I led really a 1,700 patient clinical trial in 134 sites throughout the US and Canada. Half of the patients received chelation, half of the patients received placebo, and at the end, we found that we reduced the number of heart attacks, strokes, bypasses, sort of the bad things that can happen to heart patients by about 18%. And when you add on oral vitamins, it was reduced by 26%. That's something that can have huge health implications nationally.
Then why hasn't it already been approved by the FDA, and why is it not being embraced by the traditional medical community?
Well, I'll answer the first question. To be fair, we are presenting this to the FDA later on this month, and we will see how they view the information and see where we go with it. The traditional medical community has the ability to respond much more quickly, and they initially responded with suspicion. Over time, by having a lot of exposure for these data and by publishing bits and pieces of it that are just so consistent, the overall view has turned from suspicion to interest and to the realization that there is something there. Because I've lived with this for so long, I really am somewhat farther ahead in the conversion process.
Okay.
I know that this works.
Well, I know that this is something that we're going to keep an eye on. I hope that you'll keep us updated, and thank you so much for sharing your perspective on it with us.
Lynn, thank you so much.
We'll take a short break, and we'll be back with the Meet the Doctors panels right after this.